Hello, today our group will present our oral reflection on the topic, is disease prevention the responsibility of the individuals and families or the responsibility of the government? Each member wrote an essay with their own viewpoint, and in this presentation we will summarize our ideas, compare and contrast arguments, and identify one key similarity, one major difference between our perspectives. Finally, we will explain why those differences exist based on values, experiences, and how we understand the topic. In my essay, I argued that the disease prevention is mainly responsibility of the families and the individuals. My main point is that the people have direct control over their daily habits, their diets, and exercise, and also hygiene. These choices strongly influence long-term health outcomes. I also mentioned that the government can provide programs and information and services, but it's ultimately up to the families to see if they can follow this program and apply those resources in their everyday life. Because healthy lifestyles begin at home. Individuals and families should take the lead in preventing illnesses. My conclusion emphasizes that while government support is helpful, real and lasting disease prevention depends on one's personal responsibility and decision that people make on their daily basis.
In my essay, I argued the opposite, that the government has the greatest responsibility for disease prevention. My reasoning is that not everyone has equal access to healthcare, medical information, or resources, because the government controls public health systems like vaccination programs, regulations, and hospital standards. It has the power to protect large groups of people. Another point I made is that diseases can spread quickly, and sometimes personal choices are not enough. Government rules and policies, especially during emergencies like pandemics, help keep the entire population safe. While I do acknowledge that individuals should take care of themselves, I believe the government carries the biggest responsibility because it has the authority and resources to create large-scale prevention strategies.
After listening to Axel and Marco's perspectives, I find myself agreeing more with Axel because I also think there are important points on both sides. Like Axel, I believe that individuals and families play a major role in preventing disease because daily habits such as healthy eating, regular exercise, and good hygiene have a strong impact on long-term health. As well, personal responsibility is something like no government program can replace. However, unlike Axel, I think relying mainly on families isn't enough. Here I agree partially with Marco. The government does need to step in, obviously, especially when certain communities lack access to health care or when large-scale problems arise, like government, like pandemics and all the stuff. As well, government policies, resources, and public health programs can help reduce inequalities and protect people who might not have the same opportunities to stay healthy. Overall, I lean more towards Axel's view because disease prevention really does start with personal choices, but I also believe that the government should provide stronger support so everyone has a fair chance to maintain a healthy lifestyle. When comparing all three essays, we found that even though we take different positions, we focus on similar themes. All three essays, we discuss the importance of healthy habits and access to healthcare, but we prioritize them differently. Like me and Axel, we emphasize personal behavior, the idea that healthy choices come from inside the home and affect daily life. But Marco emphasized a structural support, the idea that government policies and systems shape the population's health. Another comparison is that all three essays, we recognize that disease prevention is a shared responsibility, but we disagree on which side has the bigger role. Like me and Axel, we highlight the influence of family choices, while Marco focuses on the government's ability to protect large groups of people through laws, campaigns, and public health programs.
A key similarity between our essays is that we all agree individuals and governments should be involved in the disease prevention. Neither essay claims that one side matters. We both acknowledge that our families should try to live healthier lifestyles, and at the same time, the government should offer education and resources. This shows that both perspectives value cooperation between personal effort and public support.
The biggest difference is who we believe carries the larger share of responsibility. Axel and Gabriel believe individuals and families are the main factor because they control their habits every day. I, Marco, believe the government carries more responsibility because it can influence entire populations and address inequalities in access to healthcare. The difference changes the focus of our arguments. One looks inward at personal decisions, and the other looks outward at social systems.
Well, and me and Axel perspectives, we reflect the value of personal responsibility and the idea that healthy habits start at home. This connects to the belief that individuals have the most direct influence on their health through everyday actions. But Marco perspective isn't that, it is not the same because he reflects the value of social responsibility and fairness, especially that the idea that everyone has the same resources. His viewpoint prioritizes the role of governments in reducing inequality and protecting entire communities. We interpret the problem like me and Axel. We focus on the micro level, like households, daily choices, but Marco focuses on the micro level, like the public policy, national health programs, and other stuff. These different lenses naturally lead to different conclusions, and oh my bad. And research emphasis, like me and Axel. Essay, we use evidence about lifestyle-related illnesses, problems that families can prevent through healthier habits. But Marco's essay focuses more in public health systems and the need for policies that reach vulnerable populations. Because of these different frameworks, we reach different opinions, even though it's examine the same question.
In conclusion, while our essays differ in who we believe holds the greatest responsibility for disease prevention, our discussion helped us understand how both personal choices and government system influence our healthy lifestyles, such as public health. By combining these viewpoints, we can see that the most effective approach involves cooperation between families, communities, and public institutions. This oral reflection shows how different perspectives can connect and help us build a deeper understanding of the issue. Thank you for your time.